Hey friends, welcome back to allornonelaw. Today's topic of discussion is three different conditions I'm going to talk about and the characteristics of these conditions, that is croup, epiglottitis, and the last one is tracheitis. So I'm going to talk about the characteristics, and this is really very important for USMLE Step 1 examination and even for a Step 2 CK or any other medical board examination, and even for what you call a clinical examination, because these conditions act similarly and there are only different few points that you should remember that can help you to differentiate whether it's a croup, epiglottitis, or a tracheitis. So let's quickly start this, and before starting I will request you to subscribe to our channel and please do share our videos with your friends. Let's talk about the croup. I'm going to put as a croup, epiglottitis as a epi, and the last one is a tracheitis as triare. Croup, epi, tracheitis. Okay. So now I'm going to give you the what you call age of the patient. Okay, I'm going to ask you age. Tell me the age of the patient in a croup. What would be the most common age in which the patient presents with a croup? So remember, it's a 3 to 3. That's a 3 months to 3 years. Okay. First thing, what in USMLE, what you need to look for is the age of the patients. If you're confused with the diagnosis, try to click with the age of the patient. But okay, right? And there are other few points you should also look for. Epiglottitis, age group affected. In this, epiglottitis is older, that's a 3 to 7 years. Okay, very good. And in tracheitis, it can be similar to croup, that is 3 months to what you call 2 to 3 years. 2 years, let me talk. Okay, right? Okay, so now tell me, what would be the in a stridor, presenting with a stridor, who will present more with a stridor? And incidence in children presenting the stridor in this crop, it will be very common, that's a nearly 88 percentage. Epiglottitis, they may not present with what you call a stridor, but little there can be a stridor, and that will be a confusing or a tricky question in USMLE examination. And tracheitis will have very little. So in a crop you will see what is the most important thing, that is a stridor, remember. Okay, now let's talk about the severity, fever, what you call very important. This is very helpful and very clinical important point. The in a fever, what you call a fever, it will be a croup is a low grade. Okay, it's a low grade. So low grade, whereas in epiglottitis is really very high temperature. Okay, really very high temperature, it's gonna be high grade, we can call it as. And in tracheitis, it can be in between the low grade and the high grade, that's an intermediate grade. Okay, so if it's a high grade temperature, try to think of first of epiglottitis. The patient suffering from epiglottitis will have very high temperature. Okay guys, now let's talk about what is called the position preference. What's the position of the patients, and this is really very important clinically and even for USMLE examination. Or in what you call the position preference in a crowd, patient can be like in the mama's what you call lap or something like that. You will be in a comfortable position. Okay, this is nothing clinical significance in this, but the important thing here you should remember is in epiglottitis the patient is seated with extended neck. Extended neck, this is really very important. Okay, extended neck, that's really very important, and this doesn't have the significance over here in tracheitis. Okay, now let's talk about the what you call the onset, how it starts. Onset, it has the crop will have a prodrome of 1 to 7 days. Okay, 1 to 7 days, whereas epiglottitis is rapid in onset, it starts within hours, we can call it as a 4 to 12 hours. Okay, it can be very high fever. Okay, in 4 to 12 hours the patient will be deteriorating, that's a really what do you call very life-threatening condition also. Okay, in tracheitis, the prodrome, it starts from 3 days. Okay, and it can be within hours decomposition, 3 hours. Okay, it's not B, it's a 3. Okay, right. Now let's talk about the pathogen. Very important is a pathogen. Okay, the pathogen we are going to talk about. The pathogen here in a crop is a para-influenza virus. Para-influenza virus. Okay, PIV, para-influenza virus. Whereas in epiglottitis is H influenzae virus. And in tracheitis it's a bacteria, that is Staphylococcus aureus. Okay, right. Okay, that's good. Now let's talk about associated symptoms. Is there any symptoms that you see? Some symptoms. What are the symptoms in croup? That's really very important. You should look in the clinical history. That's a barking cough or hoarseness. Barking cough, very important, or hoarseness. Okay. Whereas in epiglottitis, the patient will have a muffled voice. Muffled voice. And very important point clinically is drooling. So dropping of what you call saliva, drooling. Okay, this is really very important. That will help you to differentiate whether it's a croup or epiglottitis. Also very important point. And in tracheitis, they may have different clinical features related to the respiratory diseases. Can be a respiratory distress, you can call it. Okay, now let's talk about the other important point, that is what you call a chest x-ray finding. The chest x-ray finding. The chest x-ray. Whereas in what you call in croup, you can see steeple sign or steeple sign. Steeple sign, very important. Okay, remember about the steeple sign. If in USM examination they give the steeple sign, then think it's a croup and click the correct answer as a croup. Okay, and if they give the thumbprint, but this steeple sign is on AP film and the thumbprint is on what you call thumbprint sign on lateral film. Okay, thumbprint. Okay, whereas in tracheitis you can see subglottic narrowing. Subglottic narrowing. Okay guys, so if you want to see how the thumbprinting looks like, just google the thumbprint and you will get lots of images and you can see and you can remember for a longer time. Now let's see the response to the racemic epinephrine. How do they respond to the epinephrine, racemic epinephrine? Epinephrine, the titer in the croup improves. Okay, it improves, whereas epiglottitis, it doesn't show any improvement on racemic epinephrine, and even in tracheitis it doesn't show any improvement. Okay guys, so these are the most important points that will help you to differentiate whether it's a croup, epiglottitis or a tracheitis. I hope this video is really very helpful for you for your USMLE step 1 or MRCPCH examination or any other medical board examination or even for a medical students also. I hope you will like this video and I am sure that you will subscribe and share our videos with your friends. Thank you so much. Take care.